What to expect in an induction. You may be one of those people who've seen the videos on social media of somebody absolutely hating their induction, and you do not want that for you. So today I'm going to tell you what to expect in an induction and how to stay calm during an induction, because I think that's really important. And this is after seeing thousands of patients induced in the hospital. I've been induced on one of my babies on my own, plus talking to millions of people online. I've seen where inductions can go awry, and I want to help you not have that happen. So thanks for being here.
Repeat, this is not a drill.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
The number one thing with an induction is to make sure that you are getting an informed consent and knowing what it's going to look like for you before you come in for your induction. I actually have a whole induction checklist questionnaire that you should be going over with your provider. I am here to tell you that even if your provider has already scheduled the induction, if there are questions within that you want answered, it is your right to have those answered by your provider. Call into the office, ask to speak with them so you can make sure that you're making the best decision for yourself. And informed consent is part of the induction process. Your provider is required to do it. And so that's going to look like you getting your questions answered for sure. And I'm here to tell you that if you are feeling forced into getting an induction, make that phone call. I don't want you to feel forced. That should not be how things are happening. Now, you might be feeling forced a little bit by your baby. Your baby's doing something or your blood pressure is growing up, and that may make you feel forced, but I don't want you to feel forced by your provider. The choice for an induction is always yours, not your provider's, not your mom's, not your partner's, not mine. It's yours. So take that responsibility seriously. The next thing to know is that an induction is usually going to mean that you need a cervical exam. There's a lot of people out there who are saying you don't need a cervical exam at all in labor. Those people are not talking about induction. So remember, the cervix is the bottom of your uterus. They're checking it to see where baby is at. And depending on what this cervix is, it changes what induction agents and methods that we use to get that cervix to open. So you will need a cervical exam. Sometimes they do it in the office the day before, but inductions in general just require more cervical exams because we got to make sure that whatever we're doing is actually working. You can have contractions that absolutely do not open this up. And so that will make us change our agent or the things that we're using. In an induction, you are going to need an IV or at the very least, at least a saline lock. So a saline lock is not attached to tubing that hangs next to you. A saline lock is just a port that we have in your arm. If you refuse the IV, you're essentially refusing the induction. We have to have an IV in. Sometimes we can start an induction with a Foley bulb or some of the ripening agents, but most hospitals are really going to want to see an IV. And just in case things go awry, we need to have that access to your veins. And if you want more information about the IV and the magical saline lock, I did a whole video on it. I'm going to link it down below. The next thing about an induction is to keep moving. So many people come in for their induction and they just want to lay in the bed the whole time. I get it. The hospital is miserable, but the more you can keep moving, even if it's just around your room, or if you can go into the hallways, that's even better. Get some fresh air in the hallways as if that's fresh air, but it's kind of a different thing. I love a patient who will lunge down the hallways when they're able to get up from the induction. Now, if you're being induced, you will need to be on the monitor at specific time frames. Sometimes we have wireless monitors. I have a whole video on wired versus wireless monitoring. I'll link it down below. But even if you have to have wired monitoring, there's still things you can do, and I share those in that video. Make sure that you are moving with an induction. It is so important. And as a reminder, inductions can be really long. A lot of people come in expecting to have their baby within 12 hours, and that is not usually the case. In that induction checklist that I mentioned at the beginning, that's one of the things your provider should go over with you. Of course, we don't have a crystal ball. There are patients who come in who I think the induction is going to be really long and it ends up being really short, or there's inductions where we think it's going to be short and it ends up being long, but they can give you a best guess based on our experience. But it's not a crystal ball, that's for sure. It is important to know that inductions have more choices with them. It's like a big old choose your own adventure book, but it just has more choices in it than like regular labor. So getting prepared for what those choices are is really important. I have two options for you in this area. I totally recommend taking a birth class. The one I recommend has a whole chapter on induction, which is pretty rare in birth classes, but super important. And that whole class can be done in just 3 hours. Now, if you're like, Hillary, it's happening tomorrow, I don't have time. I actually have a really quick cheat sheet called Inductions Made Easy. I'm going to link both of those options down below. But if you're like, which one's for me? I totally recommend the class because it also includes epidurals, C-sections, all these different interventions that you really need to know about beyond just the basics of induction. And again, I'll link both those options down below. I mean, but who doesn't love a choose your own adventure book, right? Maybe just less so when you're in pain. But man, I love those books when I was a kid. I love making choices less as an adult. Anyone else? As a pro tip, the medical nature of an induction can also freak out your partner. So please make sure that you're including them in the preparation of whichever way that you choose to do it so that they're as informed as you are at least. It can be really easy to feel like you don't need to get your partner educated, but I gotta tell you that when they're sitting over in the corner and they start to freak out, that freak out like starts to seep over to you and you're gonna start to freak out too. So getting them educated so that they're not freaking out and you're not freaking out can be so helpful. Make sure that your partner's getting educated as well. And my final tip for an induction is that you can always change your mind. Actually, this is my tip so often here on this channel. So many people think that I've made the choice to be induced. I cannot deviate from it. If you come in for your induction and they put a Foley bulb in and it's absolutely miserable, say, hey, I can't tolerate that Foley bulb anymore. Is there anything else that we can do? You can change your mind. Again, a great choose your own adventure. Or you go in for the induction and it is really just not working. You can change the mind and go home, right? Or you can say, hey, can we wait a week? Or, before you even go in for the induction, you get to make up your mind. It is always up to you. Whether we progress forward, whether we stop the induction, it is always up to you. So getting informed can really help that. But I am also here to tell you that we don't have a magic way of making an induction easy, right? A lot of people are dissatisfied with their induction because it includes pain, but labor includes pain. So I just want to be really clear and present with there is no magical way of making an induction easy. There can be some uncomfortable parts with it. So learning some natural pain management, especially early on in the induction, can be really helpful. And then understanding when it might be helpful to use an epidural can be really helpful as well. Inductions can be amazing. I actually have a whole video on the myths that I bust from my own induction experience. I will link that video down below, but you got to know what you're heading in for when you make the choice to be induced. Because remember, can I say it enough? It is always your choice. Now, it's also really important to know if you are actually ready to be induced. And so there's specific things that your provider knows, but I want you guys to know them too. So I have a whole video on if you are ready to be induced. I'm going to link it down below and up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth and possible induction.